And it's your turn to ask questions now. So we do want to turn this last half hour together into a bit of a town hall. So I'd like to invite Bashir and Jacqueline and Tracy and also David and Linda and Hilary all up to the stage to answer questions that come from you on the floor, whether it's something to do with your daily work, something to do with what's happened today, or something to do with the future that you imagine in healthcare in the Fraser region or in British Columbia, by all means. So I'd like to invite our panelists up to this stage. Thanks, Lynn. Unless any of our panelists would like to get us started. Tracy, we haven't heard from you today.
Was that the question?
Yes. What did you think about today? What are you going to take away?
It's been fantastic. I thought a lot about the work that our organization is doing around primary and community care redesign, and how that creates an opportunity for us to build a values discussion into that, because we're bringing together different partners. We're working more closely with our divisions of family practice and the health authorities. And it's in the values conversations that we'll be able to create a way of working together that works better for patients. I think there might be some barriers in that, because we can sometimes twist how we describe our values around a little bit. And I was reminded that we need to have patients around the table to speak directly to what their values are and what their needs are, because us trying to represent those values isn't going to bring us to the same end point. So it's been really, really valuable.
I'm going to come down and bug you, Michelle. She's got her camera up, so I'm going to come to you now without getting my picture taken, and get you to make a comment on what you have learned today.
I've learned that there's a lot more to healthcare than, well, I knew about it, but I think for the average person, there's more to healthcare than meets the average eye. It's complex, it's extensive, and it goes beyond what you see when you walk into the doctor's office or into a hospital. And there's so much, we've come so far, and there's so much more that needs to be done. And from today, I have gleaned that there are people like those of us here who want to make it better, who want to work as a team, who want to make a difference.
Thank you very much for being here. All right. Hilary, thoughts from you? As I try to encourage people from the floor to ask questions, the microphones are set up. I'm going to the quietest people first. So anyone who is in the room and would like to pose a question or make a comment that can be addressed by the panel, I'd like to invite you to take to the microphones. Hilary.
And remember, I have the right to pass.
And you want to pass?
No, I'm totally open to any questions that people have. What I want to have to say? Well, maybe I could speak a little bit to what David and Linda and I and Kathryn were doing in the back room while you were having your discussions around the ethics case studies. And so we were going through all those cards that you had been willing to give us and doing a pile and sort and seeing what we could come up with. And it was very interesting to see. Do you remember that triangle that David showed you from Lencioni? And the bottom is trust, conflict, that we've chosen to call having courageous conversations because it's constructive conflict. Then it goes to communication, commitment, accountability, results. Most of those cards, and I can give you the top numbers here, most of those cards were addressing that your values were related to wanting that very solid foundation in trust, in the constructive conflict, and in the commitment. And we were sort of thinking, sometimes things can get turned on their head and we think that all people are interested in are the results at the top. But you clearly showed today that if that foundation, and this is definitely, we're biased, David and Linda and I, we believe in this, that if the trust is solid, if you can have the conversations that allow for diversity and interpersonal learning, if the commitment is there because you've got a good foundation, the accountability and the results will flow. And it will be, as Lynn said, it will be faster. Things will happen much, much more quickly. So these were the numbers. There were, out of 695 cards that you were willing to share, trust came up in 88 of them. Trust was the top, 88. Respect, 65. Support, 58. Collaboration, 39. Fun, 36. People want to enjoy coming to work. Honesty, 29. Engage, 29. Communication, 25. Commitment, 23. Cohesiveness, 22. Accountability and shared accountability, 18. And then cohesiveness, inclusion, also in the low 20s. So very, very clearly, I think you have spoken today about what are the core values of the people here. And as Michelle said, that if we can have those strong relationships, even with all the complexity and technological change and flexibility, adaptability that we need to have, we can keep solid and very, very, very focused on the goals we want for our results.
Thank you. Linda, David, any comments that you'd like to make?
No.
I think that there is a dilemma at times, because when you look at the upper edge of the triangle, we talked about that while we were looking at them, and is that when you look at administration, whether it be ministry, whether it be the organization itself, or sometimes the consumer of the service, they're asking for the top end results and then accountability, whereas employees are asking for that bottom foundation to be established first. So sometimes it's no surprise there might be a sense of disconnect. So I think the challenge is how do we work our way through that triangle and move up and down the triangle. And I do remember last night, the three of us were doing some work, and we'd gone for coffee at a cafe, the Kella Family Cafe, which is a small little place, and just down the road from here. And on their wall, they had a plaque, and it looked like their vision statement, and vision was something that came up that people wanted. And it said, identify your dream, follow your heart, show compassion. While we were there, a woman came in, she appeared perhaps to have a mental health issue and suffering extreme anxiety. Now, in inner city core hospital areas, that person would have been escorted out, likely by security, and removed immediately from the restaurant. The staff person gently took the woman down to a booth, offered her a glass of water, and spoke to her in a very, very quiet voice. And as I was leaving and I saw show compassion, I thought, that checkbox is checked, that box. And you see it here. And I think that when you're vulnerable and you have shared what you've shared today, it's really evidence. It informs our practice, it informs our work, but it creates faith again in the healthcare system. So I would add a thank you to the staff person in that cafe, as well as to all of you as well.
Jacqueline, thoughts on the day?
I think today really created some opportunities for us to dive a little deeper into the conversations we have every day with our colleagues. And, just the exercise that Linda, that you worked us through today around the values, and Hilary and David, when you were talking about, how are we prioritizing those? How do we show up when we live those values? Was also then predicated in how does that show up from a patient experience perspective. So we, with all good intentions, may think we're showing up in a certain way, but that may not be what the patient is experiencing. And that was some of the work you were trying to get us to be thinking about, Michelle, when you were talking about your experiences, is that people don't come to work, as Lynn said, we don't come to work looking to make your day miserable, but how we sometimes present things can land very differently on people. And just having the courage, I think, to just do those check-ins, not only with our patients and families, but with each other as our team. We spend a lot of time together, 5 days a week, 8, 9 hours a day, sometimes longer. And just how we communicate and understand who each other is and walking that talk of who we are. I think those conversations really were started today in a different way. So thank you, because that's going to make our team stronger as we're making these shifts forward in healthcare.
Another invitation to the floor if anyone would like to make a comment. Bashir, you're welcome to the microphone. Lynn, I'm curious, because we talk about the system and then we talk about the regions, but they're all part of the same thing. So what about the relationship between the system or the bureaucracy and the people who are on the front lines delivering the care? What's that relationship?
I think there would be a relationship at some areas and some levels, and I think there would be a misunderstanding at many levels. And I think it is sort of history, habit, and tradition. Somehow the people at 1515 Blanchard don't know what they're doing, and 1515 Blanchard would say, what's the matter with you people? Why don't you just get on with it? So I think there is a misunderstanding. And part of it, frankly, we don't spend enough time together. You know, we don't do this. We don't actually. So even today, we had our team at the back of the bus and in the hallway. Next time, maybe we should be because that's how you learn each other's worlds, is when you actually swim a bit in each other's water. So.
Thank you. Bashir.
I have two questions, and I'm curious to know. I think we have sort of three types of perspectives. So from the experts, David, Hilary, and Linda, and then from our Fraser Health leaders, and then from Lynn. I think there are three ways of answering this question. I'm interested in all three, and there's two questions that are related. So the first question is, I've been invited to come to the day. I've had a good experience. It's been interesting. I've learned some skills, but I feel like I don't have a lot of power in my team. So what am I supposed to do? Where do I go from here to make sure that I actually am using what I've got today to actually bring my team forward when I don't feel like I have actually much clout to make that happen? So, and I'll just put the other question on the table as well, if I may. How do we approach our colleagues who may not see an issue, who may not see the value in relationship-centered care? How do we actually get them to come to the table? Because their partnership is crucial to moving things forward. So I'd love to hear some thoughts on that.
There's an easy couple of questions for the end of the day. Is anyone in the room prepared to answer either of those? Maybe that's a way you can be the answerer instead of the questioner, if you prefer. No? Okay. David?
Thank you.
You're sitting in the middle. What can I say?
Middle. A couple of things. In terms of, I may not have power. I don't have any power here today. I hope that we've had influence. And that influence can come with curiosity. Influence can come with questions. How is it that we do what we do? How is it that we don't spend time together? How could we spend more time together? And you know, the whole study they did with doctors and patients, where they noted in 2 studies that doctors interrupt patients in 18 and 21 seconds when in the first interview. And then they did, because they said they didn't have time to listen to the whole story, so then they did a study asking patients to keep talking and asked the doctors to keep quiet until the patient finished talking. And on average, patients need 2 minutes of their doctor's time. It's a skill set also. So that by asking questions, we make a lot of assumptions about the workplace. And it's true that if your relationships in the workplace are at an optimal level, the tasks will happen more quickly. It works that way. So that would be one piece about how could we be, and I like what you said, how can we think differently? And your response is that our hope was to increase awareness. So your response, in one person, it happened, right? Is our mission, is to create a shadow of doubt. We don't have to keep doing it the way we've done. So that's the question. Go to work with questions. And what was their second question?
Partners who maybe don't want to be.
All right, you know, partners who don't want to be partners, I'd be interested in other people's responses to this. When we get asked to work with teams, we think in teams, we think in the capacity of thirds. A third of the people love us. A third of the people sort of think we're okay, and a third of the people think we're out to lunch. We could spend all of our energy on the people that think we're out to lunch and would get nothing done. So our goal is to make sure that the people who think what we're doing is relevant stay on board. And then those who sort of question us, we want to work with that group, because if we can get half of that group, we're now at 50%. And if we can get them one by one to get over the 50%, we're getting closer to a tipping point. And what we see in teams is if you can get in your team, work with those groups of people, once you get to 55, 60, 65%, some of the others, the naysayers, will either leave because they don't like it and they still think it's ridiculous, or they'll start conforming, either simply to conform or conform from within. And you know what? None of this happens overnight. We didn't get here overnight. It's not going to correct overnight. So that we never do one-offs with teams. We did that when we first started. It doesn't work. Unless a team is prepared to make a commitment over time. Because one thing is to make the change. The other one is to sustain it. So that unless you make this a priority over the next 3 months, 6 months, a year, 3 years, and 5 years, change will be even slower. So that's sort of an answer.
How many of you in the room are thinking about your teams a little bit differently as a result of today? Okay. How many of you have a question that you don't feel comfortable asking in the room, but actually have a question about how you might apply some of this thinking to your own working circumstance? Yeah. Okay. All right. What would you like to share? Please.
Hi, I'm Frida. I work at ARH. I'm about to retire after 35 years with Fraser Health. And when I reflect on today, I've attended a few of these conferences and find them extremely valuable. And I find it helps us when I look into my teenager daughter's room when you can't see the floor anymore. It's time to see what that floor looks like. And a day like today helps me do that, to really identify why have I done what I've done for these years? Has my focus changed? At times, yes. And what are some of those factors? And when I look back at this, I've been in leadership a lot of those 35 years in several different areas, but when I look back at what worked years ago, I think the one thing at the first 10 years of practice was the frontline nurses were involved in committees like professional practice, education, all that. Now we have CNEs, we have a much more structured environment, and I think what has brought that by now, when I look at what is frustrating or what is hard, is you don't have the same buy-in from staff to be involved. They come, they do their job, they leave. When I was part of professional practice or part of the education council, and we had to be part of something. If you were, at the time was on a pediatric unit, you had to be part of some committee. So you choose. So if you don't want to end up on infection control, you pick that. Nothing wrong with infection control, but it's germy, it's dirty, it's not pretty. So I'm just reflecting today, I guess, and looking at, I have a passion for nursing, I have a passion for patients that I think if we focus on the patients, everything else falls into place. And that's clear by what Michelle said today. And I think we don't have the engagement of the staff nurse, the floor nurse, because we've taken all that away, and they're not as directly involved in those things. We get policies that come through our email that probably most people don't read. It's just hard to read. There's so many, rather than just the point. And so we're disengaged. How do we gain that ground of engaging the frontline nurse, staff, social worker, occupational therapist, that they're actually the most valued, that they feel that they're the most valued? I think as leaders, we want to give them that, but they're not feeling it there. So
Okay, well, that's a good point. Thank you very much for making it, and congratulations on 35 years. Thank you very much. Anyone else? Thoughts, observations, learnings from the day? Or points of clarification anyone wants to address with our panel? Are you all exhausted? Yeah, okay. Thank you to our panel. I think we have one more. Oh, you again. I love this.
I'm sorry. I would be remiss if I did not, before the end of the day, thank Lynn for acknowledging the patient. I was at that meeting in Victoria. I sat in that room and listened to people acknowledging patients and realizing the need to acknowledge patients, and that patients are the reason, I'm sorry, but patients are the reasons you have a job. And I don't mean that disrespectfully, but we as a team working together, we are the patient and we have a voice in all of this. And Lynn, I just want to say thank you. I really respect you and your acknowledgement of the patient, because so often as a person goes up in government, they tend to lose focus of who the people are. And I so appreciate you and who you are and how you respect and acknowledge us, the people. And I just want to say thank you.
Thank you very much. Okay, so I see that there's not a rush to the microphones, so I'm going to wrap up the day. Thank you to our panelists. Thank you very much for being here. Thank you to all of you for taking the time out. Having a full room at 4:15 on a sunny day in British Columbia is a huge deal. It shows what kind of intention you put into this. Thank you very much.